So, first off, thank you everybody for attending this. It's a Sunday morning. We're about to enter the holidays. So, I really appreciate everyone who was able to show up for this. And I think it's very fitting for this time of year that we're all about to enter. And also from our conversation in the social hour before this talk, how the Iranian community is going through intense social reform and just changes to the community and culture. So I think it's a perfect fit for a conversation such like this. So again, thank you everyone for attending. Thank you especially to Doctors Wadarasi and Raufi for coordinating this with me and reaching out. I'm very gracious and thankful that the Iranian Psychological Association of America has invited me to give this workshop. So let's get into it. So this talk is entitled Dealing with Family, Navigating the Winter Holidays. And we're going to talk about a whole lot of things. We're going to talk about basically, when you think about it, when we're told we're about to be interacting with mixed company or just meeting new people, the three things in US culture we're told not to talk about is relationships, politics, and religion. Ironically, those are the three main things people talk about during the winter holidays. So I've heard over the years with patients and just personal contacts of the anxieties people have navigating these tricky conversations at times with relatives and loved ones alike. So that's what's inspired this talk. So this talk's tips and resources come from over a decade of patient care with a variety of folks that I've worked with in both the San Francisco Bay Area and the greater Los Angeles areas of California in the US. Uh, what has come from this is the understanding that metropolitan areas host many people who go home for the winter holidays. And the following and the rest of this talk is a digest of common concerns and things many people have dreaded anticipating when going home for the holidays. So I encourage everyone always, because this is a workshop, to take notes however you see fit. And as always, first off, many thanks to the host, IPAA. I also, throughout my talks and if you use the slides, I have downloaded hyperlinks where you can access things, such as I have the Iranian Psychological Association of America's website embedded here in this slide for people to, stay in contact with that. And just as a reminder, so this talk is being recorded, so I completely understand and take no offense if some people's cameras are off. We all don't feel camera ready, especially on an early Sunday morning. So again, I understand that. And just please know throughout the rest of this workshop, resources are embedded and hyperlinked throughout these slides, like above right now. So feel free to take notes, take pictures or screenshots, because in the modern era, that's how people take notes. I don't know if anyone else is a professor or such or teaches, but if you notice, your students they're taking pictures of your slides when you're talking rather than taking notes. So I say just lean into it. So if someone is using a Mac, it's just Command-Shift-3. If someone is using a PC to take a screenshot, it's the Windows button plus print screen. And for Linux, I have no clue. So if anyone wants to educate me on how to do that with other operating systems, please feel free to do so. These slides are available in the chat box here currently, but if anyone also wants to download them at no cost off my website, the link is provided here. And also there's a promotional code so that no one is charged for these slides. All right. So who's this talk for and what's it about? So first off, this talk is for anybody anticipating interpersonal challenges from seeing their loved ones during the winter holidays. So this talk is open to those who also feel balanced enough to provide support to others as an ally. Not everyone anticipates or dreads the winter holidays. So if we are in a place where we're more stable, we can help someone out. We can help out our loved ones who may be going through anxieties or just dreading interacting with family and loved ones during the winter months. So this workshop for clinicians will help attendees develop effective communication skills and conflict resolution techniques to navigate conversations and better just cope with triggering situations prompted by conflict with loved ones during the holidays. Navigating sensitive topics such as religion, politics, and relationships amidst mixed company will definitely be explored. And what I always like to remind people when it's a workshop, these tips and skills, yes, they're definitely for our patients and clients, but they also work for us. We're also humans in this process of helping other humans heal. So, all of these tips and skills apply to us as clinicians and providers, but they also definitely apply to the patients and the people who trust their mental health in our hands, which I think is beautiful. All right. And I also, before we continue too, I want to let people know that yes, I've definitely carved out time for question and answers at the end. But personally, I prefer a more Socratic method. So if anyone has a question, a comment, or maybe feedback or input on some of the interventions I'm about to talk about, maybe examples, for example, when I recommend an intervention and someone says, you know what, I've tried that with a couple of clients, turns out it doesn't work as effectively as hoped, or maybe with this certain cultural group it doesn't work as well. I warmly welcome that feedback because that helps me learn as both a clinician and a researcher. It helps me communicate the feedback back to other researchers, because PhDs, well, what we assume is PhDs and researchers, they're the generators, the creators of clinical content. We, as providers, the clinicians, we're the ones who actually get rubber to meet road. And not everything always plays out what the textbooks tell us is going to work. So again, whenever I give talks and talk about interventions, I love feedback, whether negative or positive, towards whatever the topic is, because it helps me learn more, digest this, and also communicate it back to the researchers who are creating these interventions that we as clinicians are meant to apply. So if anyone ever has a question or just something to interject, feel free. Just either unmute yourself and maybe just ask the question. Some people like to raise their hands, especially students. And also, because this is Zoom, we have the little reactions part at the bottom tab. You could just click on that and it could like raise a hand digitally or something like that. So again, I'm totally open to feedback and input during the talk, but I will, rest assured, have a carve out space for the questions and answer section. Okay. All right. So, with the tone of this talk and the topic in general, the first question comes up, well, shouldn't family time be good? It should. Seeing family can definitely be great. It can be a wonderful time to come together, be around loved ones, and maybe grow, progress, or reflect on the year at hand. That is possible. It can also be a challenge for those facing people with whom they may have unresolved matters with, or maybe share traumatic experiences with, or maybe some people will basically be asked to confront some abusers in their past. So the holidays, picture it kind of like a pressure cooker where physiological, psychological, and interpersonal problems can sometimes worsen, yielding the truth in many matters. When the pressure's on, usually the truth comes out. So the people who raised us, if we frame it this way, they're kind of like the people who programmed us. So primary caregivers, the mother, the father, whatever you want to call it, depending on your theoretical orientation, they're the people who teach us. They help us develop our schemas or our scripts, our early internal objects, whatever terminology you want to use. Again, the people who raised us are kind of the people who programmed us. So this programming, if you will, continues within us as adults. And sometimes family time requires temporary inauthenticity or falsehood just to get by. We sometimes have to pretend we're a different version of ourselves that we're not, or sometimes we have to silence ourselves or dull ourselves down just to be agreeable around family and especially mixed company. So, particular for our patients, those on their healing journey, the winter holidays can afford also an opportunity to practice authenticity around loved ones who may have sometimes an outdated image of who we evolve into. The people who raised us typically, and we can all imagine this, like when I think of my nephews, they're always going to stay 8 years old for some reason, even though they're like 25 now. For me, I always have this image of them. So it behooves all of us to acknowledge and accept the people who we have this idea of, this image of, they're inevitably going to grow. They're going to evolve. So it's good to remind ourselves that the image we have of people might not be actually who they are to this day. Sometimes for the better that they've evolved, sometimes for the worse. And again, it's just good for us to acknowledge that they may be different. We may be different as we encounter, the people we were raised around or loved ones we grew up around. And then when it comes to this, how do we perceive and accept the changes in our loved ones as well? Well, I'm so glad you asked. We're going to talk about it for the next 2 hours. So, of the first notion that I brought up, there are often challenges to just remaining authentic and being who you are when coming back to see family and loved ones. Again, we're all based in Los Angeles here. So, Los Angeles is a metropolitan area, a transplant city where people often weren't born here, so they usually go or host people for the holidays. And again, that's some of the stress itself that people acknowledge. So going back with this analogy of the people who raised us or grew up alongside us as our early programmers, our so-called early programmers, they may hold on to an image of us from a long time ago. And it's sometimes very challenging to acknowledge how we've evolved over the years. And indeed, people grow, change, and may no longer identify under things they did in the past. For example, one may have a completely different religion or maybe no religion at all, or a completely different shift in their spiritual values or belief system. Another example is some people may have a newer or evolved gender identity. So, for example, let's say you've had a nephew that you watched raise, maybe you helped raise them, and maybe they're identifying more as your niece. How do we accept that? And how do we also provide space for them to just be their best in their newer identity, their evolved identity? This can often bring up challenges. Another example is a change in relationship status. What if you grew up and you had this aunt and uncle that you always viewed as a strong symbol of, what to be, or you wanted a relationship like that, and maybe they divorced, or maybe a relationship you always valued, maybe their relationship's going through a hardship and it no longer feels comfortable to put them on a pedestal. Relationship status can change, and this can definitely be highlighted during the winter holidays, especially when we're expected to be around loved ones. What if you don't love those people the same anymore? Or what if the dynamic has changed? This is something to consider. What if someone has shifted in their sexual orientation identity? So, if someone is coming back and they're maybe in their lifestyle they felt inauthentic and now they're moving towards a place of being authentic, more comfortable in their skin, well, much like the analogy of when rubber meets road, what happens when you're forced to see the people who raised you, who again may have a different image of you, while you're trying to assert a newer, developed image of yourself? Definitely conflict can happen with that. Or what if simply someone is just changed their style? Like, I don't know anybody here, but if you've ever been around an adolescent, they change from minute to minute. They change from week to week. They may dress one way, then they may dress another way. So often it's kind of like I always picture it sometimes with my clients when they talk about this, kind of like a forced promenade that maybe they have evolved and changed, and they demonstrate that through changing their hair color, through how they dress. Well, how's that going to be received when they go home and they're around, their grandparents? Like, how are their grandparents going to receive, their bright pink hair going on? Or how are their grandparents going to receive maybe a male now wearing fingernail polish, which is very in fashion right now? I've also noticed that a lot of young men are wearing pearls right now, ever since Harry Styles did it on the cover of a magazine. So, what happens if someone wants to adopt a little bit of androgyny in their dress, and how is that going to be received by their family, and how are they going to uphold this newer version of authenticity? And moving on, what if someone is changing their diet? The winter holidays also focus a lot on food oftentimes, and our cultures often are demonstrated through the food that we consume and the meals we share with people. Well, for example, what if someone has been diagnosed with hypertension, high blood pressure, and they can't eat the delicious salty food that they were anymore? Are they going to offend the host who's prepared this food? What if someone has recently been diagnosed with binge eating disorder, and part of their treatment plan is to reduce the amount of food that they consume during a time when the winter holidays typically support, excess, indulgence, gluttony? Like, we're about to have Thanksgiving in the United States in a few days. I've worked in the past with people living with binge eating disorder, and we've had to adjust our treatment plan to include, okay, how are you going to politely decline food? How are you politely going to be able to say, you know what, I've had one plate, I'm good? So these are all things to consider while we're trying to develop new authenticity during the winter holidays, which may promote the exact opposite of what we're trying to change in a person. And on that note, too, sometimes people have just health conditions they need to consider. So maybe someone has been maybe diagnosed pre-diabetic. How again do they navigate, holidays that tend to center around food, and how do they do it respectfully to their own body, and how do they do it respectfully to maybe the host, or if they're supposed to host an event, how do they prepare food that they're not supposed to eat but they encourage their guests to eat? So there's lots of tricky things to navigate, and I haven't even got into recovery. What if a person is changing the substances they put in their body? The winter holidays often also associate substance use overall. Some people try to self medicate with a substance to help themselves deal with anxiety being around family. Sometimes rituals within a holiday do include substance use. Um, so if someone is maybe newly in recovery, or maybe they're in recovery and maybe need to just prevent relapse, how do we navigate that and how do we adjust that in our clients' treatment plans? We're going to discuss this. Or overall, what if people just have different priorities in life? So what if someone is maybe has a change in their relationship status? Maybe they were single and now they're partnered. And what if someone has to deal with the anxiety of choosing between, okay, do I go with my partner's family? Do I go with my family of origin? Do I bring my partner to my family of origin? Or is my partner bringing me to their family of origins? Different priorities in life. So suffice it to say, the winter holidays and just the dynamic, evolving nature of humans can really be highlighted with the winter holidays. So, first off, again, talking about the three main taboo topics we're not supposed to talk about a mixed company, yet the winter holidays encourage us to talk about, again, relationships, religion, and politics. So, we'll start with relationships. First off, many people don't look forward to experiencing unequal treatment or singleism if they're unpartnered. I've heard countless clients who are single at the moment approaching the winter holidays just dread the thought of having conversations with their elders or just other loved ones who are constantly asking them, when are you going to find a wife? When are you going to give me grandkids, or things like that? And as if the person probably wasn't trying to find a partner this whole time, or maybe trying to conceive. And that's just one example, but I often hear people just unpartnered or single people experience what's called singleism, where it's the assumption that being partnered in a monogamous heterosexual relationship is the gold standard. Anything other than that means someone is somehow deficient or not good enough. I've also heard unpartnered folks anticipate receiving unrequested dating coaching. So if someone is unpartnered for whatever reason, so, someone could be single actually by choice, or someone could be single and just realistic about it. Like, you know what, I was trying to date someone and it just didn't work out. I've often hear my clients report that they dread maybe, I don't know, their uncle or their family friend, at the dinner table saying, okay, well, you're single, but let me help you fix it. Let me give you unrequested advice on how to make you the most eligible bachelor or bachelorette. Let me give you the skills that worked for me in my relationship, because I magically think they're going to work for you. And I've often heard clients just telling me about just sitting there going, yep, thank you. Again, just reacting to unrequested dating coaching. Um, Moving on, I've seen many couples, so partnered people, dread unrequested marriage counseling. So these are two people figuring out their own relationship, because each relationship is its own unique dynamic. But I've often heard, when I do couples work, them saying, "Oh, if we go to her house, see her family, I know their grandma is going to tell me X, Y, and Z, or they're going to check in on me and make sure I'm being a good partner or I'm being a good husband, etc." So these are just some of the things people have reported anticipating and being a little anxious over, because they've seen it time and time again, or they've experienced this year in and year out. or perhaps their own personal contacts or loved ones have told them, okay, be mindful of Uncle so and so. He's gonna tell you to get married, really fast, or he's gonna tell you exactly what to do to keep the marriage safe, even if you didn't ask for it. So, moving on, some of the anxiety around relationships during the winter holidays can also center around bringing a partner home or going to meet a partner's family for the first time. If it hasn't happened already, many people find it a great time to, during the intensity of the winter holidays, to either meet or introduce themselves to a new family. And that could be stressful in itself, even if it's not the winter holidays. Let's say you did this in the summer, it still can be very anxiety provoking for many people when they're possibly meeting their future, mother in law, possibly meeting their future father in law. And imagining or anticipating being grilled, being quizzed on if they're a good person, if they're good enough to be the partner of whoever their younger loved one is. So, one particular example specific to the queer community, which is one of my clinical specialties, if someone has recently come out that year and as LGBTQ plus, for example, this could be a significantly delicate event. So, A, coming out as LGBTQ, B, acknowledging and claiming who your partner may be, and then C, bringing them or going to meet your partner's family. That's just a whole lot of anxiety, in my opinion. Alternatively, some partners may fear being interrogated or grilled, as I mentioned moments ago. Some people may really not want to be, put under the microscope by the new people that they're going to meet. And you hear this across cultures. There's usually some sort of cultural interrogation process to make sure that person is a good fit for the family and for being introduced to just their lifestyle. And of course, partners interacting with family doesn't always go well, and conflict can unfortunately happen. And down the road, we're definitely going to talk about conflict resolution techniques and just skills to apply when meeting new people or maybe having unfortunate conflict with people who maybe your in-laws soon enough, or maybe a new family that you may join or merge your family with. Any questions so far? Okay, great. So traditional stress, part of the reason that this talk even exists. Winter gatherings mean people will be mostly more closely packed and sharing spaces and food with each other. So, psychological stress or maybe mild anxiety can certainly come from upholding traditions. So, try allowing some flexibility in these traditions. Whether you're hosting or going somewhere, think of traditions you'd like to make your own. And this is something we can definitely communicate to our patients, and we can definitely hold for ourselves as well. Because again, we're humans in all of this world as well. We're in a healing profession, but we're also people that can very much benefit from that healing itself. So, what I mean by upholding traditions, let's say your community, your culture has certain things that you just do during a certain holiday or during the winter months. Upholding traditions can cause stress because you have to encode this, you have to recall it, and it can be just cognitively tasking. It can also be very emotionally taxing as well. What if your winter holidays commemorate a very important time for your community? What if they communicate a very important time for one's spirit or one's soul or whatever anyone calls their life force? Again, upholding traditions can be very taxing. And sometimes I've often heard my clients report that just upholding the traditions takes away from the true meaning of what that holiday is even about. They're more concerned about sometimes the clothing they have to wear or can't wear. They're they're sometimes concerned about um, having to read something out loud to people or having to facilitate something that just adds more stress to their already maybe busy lives. So these are just some examples I've heard. It's also important to communicate to our clients and to remind ourselves that choosing not to be bound by a tradition is also okay. And being okay with that is a challenge in itself. So that's something that should definitely be processed if it comes up and is of a concern to someone. It also behooves us as clinicians to guide our patients through the following checklists if they're forced or in a place to host holiday events for the first time. This is Something that my clients have reported, it can be a very big challenge or pop quiz in itself. Like, what happens when me and my new partner, maybe we're recently married, maybe we're newlyweds, and it's our job to host Thanksgiving, or it's in our family's traditions and culture for us to attend a certain event somewhere else. Hosting events can definitely be stressful because you have to manage a space, you have to clear out your schedule for this, you have to just facilitate, hosting what's hopefully a pleasant event for people. So there's a bit of a performative aspect. And whenever people are sometimes maybe feel forced to perform, again, the stress can really pile on. So for those in a position to host, maybe for one of the earlier times in their life, the following are a good checklist to run our clients through. It's beneficial to remind them that being a good host is progress, not perfection. I'm sure everyone, on this call right now can talk about things that maybe didn't go, that were planned, but maybe didn't go as planned during the winter holidays. So remember, adopting this from AA, it's progress, not perfection. At some point, maybe you can laugh that, oh, remember Thanksgiving 2016, or remember how that all fell to pieces, that you can maybe laugh about that, in the future. And remember, as I mentioned moments ago, hosting doesn't have to be a performance. It may feel like it, but it doesn't have to be. If it does feel like a performance, you're likely not going to enjoy your own event. So I've often heard this, especially like with weddings, when people plan to do a dance or give some sort of performative aspect in the wedding, that they're not enjoying it. They don't get to enjoy their own wedding because they feel like they're on call or on the clock right now. So remind yourself that hosting doesn't have to be a performance if you don't want it to be. It also is beneficial to remind our clients to keep the environment welcoming and authentic, however they see fit. If that means having the lighting a certain way, if that means having enough seating or not enough seating to facilitate people walking around, whatever feels like you, remember that the hosting space, typically one's home, is just an extension of you. So if your home genuinely feels like an extension of you, feels authentic, then that's already setting a good foundation for a pleasant time when hosting. Also, just logistically, it's good to know how many guests fit in your place because that's a safety concern, could be a fire hazard. And on top of that, too, knowing that we'll be in close quarters on the hind end of a pandemic and it's just cold and flu season already, just know which of your guests may be immunocompromised and just consider communicating this even in the invitations. Some wonderful examples I've seen of this are listed below, such as this gathering may have a variety of ages and various health statuses, so please plan accordingly. Or I've seen it be just very direct, saying some guests may not be vaccinated, allowing the person to make their own decision on how they want to take their health into their own hands. Again, giving it the hind end of the COVID-19 pandemic, and it's also just cold and flu season as well. And those can be dangerous, especially for our elders or anyone who's immunocompromised. So, just things to consider if you're having to host during the winter holidays. So, one thing that could definitely come up, particular to relationships, is shared parenting, especially during the winter holidays. It's just a fact that half of United States marriages end in divorce. So, probably half the people in this room can understand what that's like. We've either experienced divorce as the children of it, or we've been the divorcees in this process. So, blended families are just very common in the United States currently, and split families are also very common. So, it's just a reality. So, for example, women slash mothers often get primary custody. So, a holiday may be a rare time for those children to see their other parent. And that's particular to California as well. Women tend to get custody if it's a heterosexual marriage. Women tend to get custody. So maybe their kid hasn't had much time to see their father, and again, the winter holidays afford that time for them. And after a separation, the children may miss a holiday as it was before, and they're coming in with the minds of a child, so it's very often black or white thinking, especially for my psychodynamic people. So children who are going through separation, they miss the holidays how they were, they can feel torn, as if like spending the holidays at one parent's home rather than another could cause a problem. Often children adopt the problem as well. Many children feel that they caused the divorce, and they feel that maybe them seeing, maybe both them wanting to see both parents during the winter holidays is somehow going to cause more problems than was already there that caused, the divorce to happen. And guilt can unfortunately and often be used to compel kids to go to a parent or relative's home. Children, unfortunately, can be used as pawns during divorces in general, and then especially during the winter holidays, it can increase. So parents that share custody may passive aggressively battle through gift giving, which really just teaches children whom they can depend on when they need a new iPad or the latest iPhone, not necessarily who they can rely on as a parent. And unfortunately, I've seen this a lot, especially with couples therapy, when we as clinicians, when our goal is more to help the couple amicably dissolve, you often see this come up. So that's why I always put it in couples therapy treatment plans to just talk about, okay, what's going to happen with the gift giving season? Is someone going to be, because I've seen this unfortunately, where one parent maybe has more financial means, so they make sure to get their children everything during the winter holidays, everything as a gift, making kind of incentivizing the kid. Well, do you want to play with a new PS5? Do you want to do all that? Well, if you want that, you have to come to my house, not your other parents. So, unfortunately, I've seen that used a little too often. So, if children are distraught, they're likely feeling things that they can't be articulated because they're coming at this with the mind of a child. Again, black or white thinking. I'm either happy or I'm sad. One parent is either all good or one parent is all bad, or, and I see this often. So it's best to listen closely and not force any togetherness. If a child going through the mourning process, which poor thing, they don't even have the words for this to understand that they're going through mourning. They're mourning the family that was, they're mourning how the holiday season was in the past. Often we hope it's helpful to force kids to go somewhere, or force them to attend a certain event or just sit on our lap or be around us. If a child is demonstrating that they just don't want to be involved in any togetherness, part of maybe their grieving process for the family that was, it benefits them more to allow them their own space. Maybe if that's not congruent with the family traditions or what happens, maybe putting a time limit on that is helpful as well. So let's say, for example, you're going to sing some Christmas carols and it's something your family does every day, but the child doesn't really want to be involved in that. Maybe letting them play outside or play with their new toys for maybe 45 minutes or such, and then they can come back is more beneficial than forcing them to participate in something that they're just not engaged in. Also, unfortunately, forcing children to engage in something they just don't want to participate in down the road can lead to and or foster a sense of resentment. And again, we don't want that. We don't want any more negativity or potential anxiety being developed during this time of year because it very much gets encoded in us. And a few slides from now, I'll talk about the anniversary effect, which can definitely stir emotions up again, kind of out of the blue. So if kids wishing to see a parent when there has been a divorce, if the kids wish to see a parent, it's not helpful to make them feel guilty or disloyal for choosing to be with one parent or the other. Again, especially if divorce is newer and they're trying to figure out how they're going to navigate basically having two homes now or two families often, it's not beneficial to make them feel bad for wanting to see both parents. It's not beneficial to make them feel disloyal to one parent for just choosing to be around one of their parents. I mean, you only get two, and you only get two for the rest of your lifetime. So, allowing those relationships to continue on, even if divorce has restructured the family, never helps. Okay, next fun topic related to relationships, acknowledging abuse. So, emotional abuse and physical abuse unfortunately have been a part of many people's experiences while growing up and moving throughout the lifespan. During the winter holidays, it may feel incongruent with the many that are gathering who are hoping to join, around joy and warmth. So while some people are feeling a lot of anxiety and distress, sometimes it's very curious for that feeling of dread to be juxtaposed with kind of forced jolliness, forced happiness. Because often many people are kind of spoon fed, oh, it's the holidays. It's the most wonderful time of the year. It's supposed to be magical and loving. And often people don't feel that as such. So there's a lot of cognitive dissonance I've seen with clients around this time of year. I've also, I don't know if anyone else can agree with their patients, there's sometimes that inexplicable air when the time changes, which is kind of an environmental marker, when the clocks get set back and it starts getting dark earlier, maybe courtesy also of seasonal affective disorder, people start to know, okay, the time of year is changing, it's getting dark earlier, maybe my mood is going to get dark as well. So I don't know if anyone else, any other clinicians have seen that, but I just noticed that people's mindset, I always have to check in. I'm like, okay, the winter is coming, the holidays are coming. Do you feel any dysregulation or anticipate any dysregulation with that? So if abuse, and this slide is particular to anyone who has suffered abuse, or if any trauma informed clinicians have clients that have suffered abuse, it's very beneficial to remind them of everything on this slide here. So, if abuse was a part of one's history, know that you are not alone. You, the client, are one of the millions of whom these holidays may mean having to share a meal with one's abuser, for example. So, please know whatever your choices about joining a holiday or declining attending a holiday are, that you're one of the millions with whom there's real pain. Sometimes the pain that we feel subsequent after abuse, I mean, you can't point to it on a chart. You can't really tell your doctor where the pain is, but it's real. So, whatever stage of recovery one is with these childhood traumatic experiences or adult traumatic experiences, whether one is just acknowledging it or not, or perhaps if they work through much of it, do what's right for your health and your well being. And a few slides from now, we're going to talk about boundary setting, conflict resolution. So, all that's coming. Know that you matter every day. There's not a day where you don't matter. And if you're feeling alone with your abuse history, know that you're not alone in this. You may feel by yourself, but you're certainly not alone. If you're a parent now, but you've suffered abuse in your history, whether this is known by everyone or just between you and your abuser, always consider getting professional help around introducing children into the context. Remember, if you've suffered abuse as an adult, you're in the driver's seat now, and you can better think through your choices. So always remember to protect those with the least amount of power, which is the children. So help in making Not One More Child motto into a reality. And embedded here, I have a hyperlink to the Not One More Child campaign, which is a free resource that helps people work through abuse, process abuse, and better construct it in our treatment plans as clinicians. Also, for anyone that suffered abuse or as privy to it or maybe suffered it by proxy, again, I mean, I'm talking to a room full of clinicians. Getting professional help is one of the best things possible. It's that objective voice that can help one process pain that's been suffered. And again, that pain sometimes gets highlighted with the winter holidays. We're told it's supposed to be a magical time of the year, but it doesn't feel like that for many people.
There are two lovely comments in the chat box. One says loving the presentation. The other one says recovery from your experience, awesome reframing.
Yes. Yes, thank you. I can't with my performing view right now see the chat box. So yes, if anyone could read any questions that come up, that would be really helpful. Thank you to that comment. It's yeah, resiliency, which is something we will talk about too. Resiliency is definitely a skill to develop and also a skill to highlight if your patients are already coming with a certain level of resiliency for that. So thank you for the author of that comment. So entering the winter holidays after a significant loss. So, again, a significant loss can be considered like a divorce or a restructuring of one's family, but also as people transition out of this existence into whatever your culture tells you is the next transition to existence, that's definitely a significant loss as well. So, during the winter holidays, family gatherings after the loss of relatives can be particularly heavy. Often our loved ones in their absence leave a void. And again, if the winter holidays tend to be around family gathering or celebrating, one's higher power, when elders, especially, or loved ones are missing and leave that void, it can be very heavy. Grieving can take years. And we're all prone to what's called the anniversary effect, which is a social psychology term. And just a refresher for the clinicians here, the anniversary effect is the phenomena where you typically around the anniversary, so the year, 2 to 3 years out of a traumatic event or a negative event, we tend to feel that same negative affect. So most of us have experienced this, like with 9/11. The year after was very somber. Okay, so September 11th, 2002, 2003, 2004, it was very somber for all of us. And I imagine this happens always after now the countless mass shootings that happen and such. So whenever there's a negative event, we tend to remember it around the anniversary time of that year. And if it's also during the winter holidays, that can get exacerbated as well. But we're all subject to this. Most people can think of a bad breakup, a time they lost their job, or just any negative event. We tend to just experience the phenomena of just remembering it around that time, same time next year. And it typically happens for humans 2 to 3 years out significantly. Then we tend to desensitize ourselves to the pain of it, which also speaks to the resiliency of humanity. So, again, it just behooves us all to know, as both clinicians and with our patients, that we're all prone to the anniversary effect. So it's really good to inoculate our patients by letting them know, you know what, it's just very common. You're very human for you to maybe ruminate or sometimes obsess, have obsessive thinking patterns around a negative event around the anniversary of it. It's human, it's what we do. And maybe you, in your treatment plan with your patient, can talk about maybe coping skills on how to decrease rumination or negative thinking patterns, or maybe empathically challenge negative thinking patterns around the anniversary of bad events. So, indeed, encouraging our patients to process instead of ruminating over grief and loss is one of the first steps. We're all allowed to remember things, okay? But when it becomes a clinical concern, when it becomes a clinical concern when it's frequent, intrusive, and unwanted thinking patterns, or sometimes called obsessive. When we're ruminating obsessively over a negative event, that's a beautiful opportunity to encourage our patients to process it. So, talk about the entire narrative or play the tape out, as Alcoholics Anonymous use. So, when a negative event arises, our brain cognitively wants to just throw it out of our mind. If it, excuse me, if anyone's worked with like post traumatic stress disorder cases, it's usually that fear that rises in them first. It's that fear, and then they don't want to remember the negative event, but trying to not remember the negative event inadvertently reinforces it. So it's about processing it. Let the negative memory rise, play out the entire narrative as like imagined exposure or systematic desensitization, and maybe also talk about what lessons have been learned from that negative event and what lessons you've learned not to do in future events like that. So again, when someone reports ruminating, encourage them to process instead. So, if not already part of one's like personal or spiritual practice, taking moments to reflect on past loved ones can very much help. And this can be done by a few ways, such as when one is ruminating over the loss of a loved one, it's sometimes helpful to share funny stories about them or just highlights about their life, kind of taking a more commemorative tone rather than a, again, ruminative tone about loss. Also, one technique that's helpful is passing along lessons and teachings learned from that individual who's no longer with us. This is also a way to honor someone who's left our family and our life. And again, it's a way to highlight the positive that they instilled in us and are leaving behind. And most people love to know that they're leaving something behind. This also models good behavior for people moving throughout the lifespan. We're all moving throughout the lifespan. So if a child right now hears their parent reminiscing positively about their grandparent who has passed, this is going to unconsciously reinforce that, okay, as long as I keep acknowledging family and acknowledging pain and loss without ruminating into it, one day people are going to reflect positively on my accomplishments in life. So it's all about modeling this positive processing rather than falling into rumination. And highlighting the positives from our elders that have passed is one good technique in doing that. Also, it's really helpful to avoid grievances, especially if someone has passed. You're never going to win an argument with someone who's not around to to argue their end of the story. So just remember, yes, you're allowed to vent, you're allowed to process any negativity you may have held towards someone, but just know getting into an argument with a person who's deceased just doesn't lead anywhere. It just falls more into rumination rather than processing. And for a family, if their loss of a loved one is recent, it's okay to tell people that you're not feeling up to celebrating the winter holidays this year. Most people understand. Again, we as psychologists know, or psychotherapists know, the grieving process is wildly unstructured. What may be healthy grieving and mourning for one person may look completely unacceptable for another person. Or one person's culture may say this is okay, or this is what we do when we're grieving and mourning, and that may sound absurd to somebody else. So, however people process grief and loss, let them. And we all know in the DSM, after about 2 years, that's when, if depressive affect and negative thoughts persist about the loss of someone, then maybe that dips into clinical territory. But beforehand, we're allowed basically up to 2 years of grieving however we see fit. And it's wild for all of us. And as mentioned a few slides before, especially children who don't even have the concept, who may be even learning the concept of life or death, they're definitely going to grieve and process in their own unarticulated way. And that's okay. Mourning is normal, and people need their own time and space to do so. I swear this is going to get positive at some point, too. Okay. The next buzz topic, discussing religion during the winter holidays. So, the winter holidays, clearly, holiday comes at least in English from holy day. So, the holidays are inevitably enmeshed with spirituality and religiosity. The winter holidays tend to focus on spirituality, and everyone has their own understanding of how this world works in a personal understanding, belief system, faith, or religion. In the United States, we have over 4,000 religions in the world. And again, in the United States, 3 of every 4 people, so 75% of Americans, identify under a faith or belief system. So that's something to be acknowledged as we enter a season of acknowledging people's faith. One thing that I don't have added here, too, that I do want to interject is those who don't have a holder faith. So the 1 in every 4 people who maybe identify as atheist, agnostic, or some religions call them none, None, like they're a nun, they may also face discrimination because a lot of people don't acknowledge that in the United States, people who identify as atheist or non theist are actually receive their own religious persecution, but it's kind of like non religious persecution. So that's something to acknowledge as well, too. What if you don't adhere to a faith during a time where everyone's being told, talk to your higher power or attend, tabernacle, church, a mosque, go do something religious when you don't believe in that? And again, just over 4,000 religions around the world. And in the US, we have about 60 religions. And we even have a few religions developed here, such as like the Church of Latter-day Saints, the Jehovah's Witnesses, and so on. So, with there being over 60 religions in the US alone, numerous holidays are observed during the winter months, suffice it to say. Religiosity increases during the winter holidays, and people tend to fall into tradition, which again can provide an added stressor. So, there may be some people who don't fully identify within their religion. They may be culturally, whatever they say, maybe culturally Christian, culturally Jewish, etc. But again, during the winter months, people tend to lean more into their religiosity, and that's fine. And I think all of us as clinicians can know that subscribing to a faith is beneficial for one's mental health. And it's not saying that one should, but if one does believe in some sort of higher power, some sort of network, or some sort of governance to the universe as we understand it, those people tend to have a little more elasticity, a little more resiliency, and a little bit better ways of adopting coping skills to accept the challenges in life. But that's not saying that people who are non-theistic, don't have these skills as well. So more on religion. That said, having a spiritual practice, yes, can be great, but our beliefs often evolve. So this was like mentioned in slide number 3, that, okay, we may adhere to a belief system or our family may believe a certain belief system, but our opinions may evolve, it may have shifted. So coming back to our loved ones with an evolved sense of our spirit and such can sometimes have some conflict, especially if conservatism or if strict adherence to tradition and religion is highly valued in a family. So, also, it's good to note some folks may have been harmed by a certain belief system and they may actually choose to leave. Like I can say with some of my clinical work, uh, sometimes the clinical work is getting someone to get over spiritual abuse or it's helping someone leave a belief system that may have harmed them. So some people may be triggered by religious practices they no longer observe that they may feel forced into adopting or participating in. So that's just always something good to acknowledge with that. I'm having an issue with moving some items around. So again, some people may be triggered by religious practices they no longer observe. And again, I've seen this a whole lot in my clinical work because, again, I specialize with people in the queer community, and not many religions are really opening to that lifestyle and that way of forming relationships. So I've seen many people experience and process spiritual abuse, which is really, and I have a hyperlink here, it's any form of manipulation or harm to a person based in spiritual values. And again, people can get triggered, reactivated, or become reactive or re experience spiritual abuse during the winter holidays. Um, it really benefits us to challenge yourself to understand that the region we were born in heavily influenced the belief system we may hold in adulthood. So I'm trying to point out the subjectivity of our belief system. If one finds value and worth and just place and community within a belief system, that's beautiful. And also just acknowledge that where you were born highly influenced that. So that in part is what makes some of the differences between us. So it's up to us whether we feel like we want to focus on the differences or focus on what we share. And that's something I highly encourage. We may have evolved or just different or no longer hold religious or spiritual practices that our family of origin may have instilled in us. So again, you're never at a holiday dinner or a family dinner going to convince the other side. The same sense of conviction and belief one has in a belief system is often the same sense of conviction and disbelief in that same belief system within the other party. You're never going to convince or sway the opinions of others on that. So again, it's good to highlight on how we're similar and what values we may have aligned rather than what values and beliefs we don't have aligned. Because again, you're just not going to win. No one's going to win that battle. So that also crosswalks into debating politics, because in the United States, we're supposed to have a separation of church and state, but personal opinion, I just don't think that exists. Think about it, this country, all of the federal holidays follow Protestant holidays. Most of the holidays here, and just the calendar, the Julian calendar, follows certain values, because this country was instilled under Protestant views. Not everyone also identifies or believes under that. But the separation of church and state is questionable, in my opinion. So debating politics inevitably comes up because if in light of a recent election, we definitely know how faith and beliefs can influence the laws that get put into the bills that get put into law. So debating politics is the quickest way to change the tone of a celebration. Many people have strong political opinions, and many folks like to discuss them during the winter holidays, despite better advice. So common political themes many of my clients report not looking forward to talking about are the following. First off, the dichotomy of voting conservative versus liberal. We're a country that's technically not a two-party state, but it kind of is. And I see many people just exhausting themselves trying to argue for conservative versus liberal instead of true to psychology, thinking of things as a continuum. One can have conservative ideals, one could have liberal ideals, and it can be on a continuum rather than black and white. Also, it benefits people to acknowledge there's multiple spectrums. Are you fiscally conservative but socially liberal, or vice versa? It's really good to have an understanding of where we're coming from if we're forced into some sort of debate, or if we choose to enter some sort of debate during the winter holidays with loved ones. Um, Other current events that people dread talking about is the COVID-19 pandemic. We've all experienced it. So often, some people just don't want to talk about a traumatic event they've experienced. Other times, people want to process it, want to vent. But that doesn't mean everyone in your circle in that moment also wants to talk about this really colorful topic and this heavy topic. Also, just in current times, there's multiple social justice causes going on. Like, I appreciate I'm talking this to an Iranian American association right now. There's a whole lot going on in the mother country. Lots of social reform, lots of things going on. Not everyone you're going to be around in the winter holidays is maybe going to share your same views. And it's just healthy to acknowledge that a debate may happen. So you can choose to enter the conversation or you can choose not to, and that's okay. Another salacious topic that people do and do not want to discuss at the same time is climate change. So it's happening in our environment around us, and some people want to talk about it, some people don't. Again, it's good to just arm ourselves with knowledge to inoculate us to the big topics that people do and do not want to talk about. And then also in 2022, the various wars ending and beginning. I mean, these really impact a lot of communities, a lot of people, especially in the United States. But again, some people do and do not want to talk about this. And politics overall may inevitably intersect religion, as we talked moments ago. So, moving on to relationships and the intersection with culture, the intersection with politics too, is our relationship to culture and food. The winter holidays can help us reconnect to our culture through food and meals that often follow a tradition. Like before this talk even began, I got invited to share a meal with one of the attendees, and I can't wait because I love to eat. But again, food is sometimes the channel by which we maintain tradition and hold our family together. Like, think about it. It's just very steeped in US culture to have family dinner, maybe every night or maybe, once a week, for example. So sitting around a gathering, it's very primal. It's very much a part of our species. The people we sit around and eat together around, the people who nourish us, the people even all the way back to the mother feeding the child through nursing. How we receive physical nourishment often is intersected with how we receive psychological and spiritual nourishment. So it's a part of many customs to urge people to eat more or to refill people's glasses or plates without asking, for example. So that's something just to acknowledge and consider. Many people often, of the positive things I've heard clients, reminiscing about when the winter holidays are approaching, they're like, oh, you know what? Mom's dish is going to be delicious. Grandma's meal is going to be really good. Oh, dad always cooks really good steaks around, this holiday. So that's something that people can hold on to and maybe anchor themselves in the positive with the upcoming winter holidays. And also, United States consumer culture often encourages indulgence and overindulgence, which is something we'll talk about also in a few moments. It's just healthy to acknowledge, again, appreciating the biopsychosocial model of our work. Winter weight gain can happen. And so people's bodies shifting or gaining more mass can also have psychological impacts as well. Again, what if your client is dealing with diabetes, mellitus? That also has a strong mental health component correlated to clinical depression. Or again, the example I used, what if your client is working through disordered eating, whether restrictive or binge eating? This is something to consider when, again, the holidays really encourage indulgence. Some folks may actively have disordered eating habits, like I mentioned, or maybe recovering from such. And again, it's helpful to acknowledge that this is a thing. So, us as clinicians, it really benefits us to, as the winter holidays are approaching, just simply check in. Even if disordered eating is not a part of the diagnosis or the treatment plan, it's still good to check in on this. Because I've always say, if you check in with a client on something and they say, nope, it's not a problem, well, it's good to verbalize and acknowledge that that is not a problem for them. And that also may be an area where they can provide support for somebody else. So maybe your client doesn't have disordered eating, but maybe their child does, or maybe their sister, who they're going to see during the holidays, does. So, how can they acknowledge the challenges their loved one may be going through, and how can they provide support as an ally? And, for example, with disordered eating, those prone to binge eating may very much be triggered. So, if one is working with a case that's living with binge eating disorder, encourage them to work with a sponsor if they're connected to OA, Overeaters Anonymous. For example, attending more OA meetings during the winter holidays can definitely help. And also, 12 step has framework during the holidays to help people. And we'll get into that in a few moments. Or right now. That's the next slide. So, exploring alcohol and other drugs during the winter holidays, including just all addictive habits, which can include, sex, it can include food and things like that. So, it benefits us all to remember that relapse occurs highest during the winter holidays, sometimes called the Bermuda Triangle of addiction in 12-step programs. So you have, at least just with the US, we have Thanksgiving, Christmas, and New Year's. So that's nicknamed the Bermuda Triangle of addiction. Some, for example, may plan a holiday bender before attempting sobriety after New Year's Day. And you just hear this empirically over and over again. Ask many people who have long term recovery. Usually their recovery time is somewhere in January, meaning they probably tried to self medicate and cope during the holidays with their drug of choice or their addictive habit of choice. And then come January, everything's said and done. Then they attempt sobriety. Works for some, not for all. And it's just okay to acknowledge that. Substance relapse, in particular, has a relationship to domestic violence increasing. So that's something to be acknowledged as well, which we will also in a few moments. So part of the work in addiction recovery, and if anyone else has experience with this, please help, interject with other interventions you may have as well. So for example, if someone is trying to recover from a particular substance, it's really beneficial for that person in recovery at family events to bring their own alternative or their own compensatory substance in place of one's problematic substance of choice. Meaning, for example, if you were an alcoholic, bring your own pack of water, bring your own non alcoholic alternatives, because the host may not have them. Sure, you can tell the host, but also that involves disclosing. Some people are in early recovery where they're not even comfortable telling people they're in recovery. So, plan accordingly. Or, for example, having a nicotine free vaporizer in place of cigarettes if one is attempting smoking cessation. It's very steeped in many cultures to smoke tobacco or cannabis or other items as well. So, having your own compensatory alternative, highly recommended. Definitely add that to the treatment plan if that's part of your work with a client. And reminder, the number one prompt to relapse is being offered the substance directly. So if you're recovering from alcohol and someone hands you a shot, that's one of the main catalysts for relapse. Or if you're, attempting smoking cessation and you're outside, someone hands you that cigarette, you're more likely to relapse if someone directly, especially a trusted loved one, offers you that same, substance. So it's really beneficial to let our clients know, to let important people know what they should not offer you. But that often involves disclosure of attempted recovery. So that's a conversation that also needs to be explored through therapy. And I got to be delicate with this because I'm not overtly saying lie, but sometimes it's okay to have a temporary reason why one is abstaining from a substance or behavior, especially in the early days of recovery. So, for example, I've heard many people recovering from alcohol say just quickly that they're taking antibiotics and that's their reason for not drinking. But just acknowledge maintaining a lie is laborious. But if it's a temporary means to an end, okay, so be it. Talk about it with your therapist, talk about it with your patients, and see what's that. Also, too, with attending events where they know their substance of choice or their addictive habit of choice is going to be highlighted, sometimes just having a hard ending time when one has to leave, or having that said in the beginning, it's like, oh, grandma, grandpa, thank you for having me. Just know, I have to leave at 10. I'm sorry for whatever reason. Having that hard ending time at an event where you're going to be triggered is also helpful. That's also part of setting an appropriate boundary. And if anyone has any other suggestions too, please, this also helps me learn as well. Okay, so more on AOD, or alcohol and other drugs during the holidays. If your clients are in recovery and they are susceptible, or they work well with the 12-step model, definitely encourage them to attend online or in-person marathon meetings. So a marathon meeting is when 24 hours they have just rolling meetings. So 1 p.m., 2 p.m., 3 p.m., all the way, 2 a.m., 3 a.m., 4 a.m. So it's a containing space where people in recovery can attend a meeting, and if they feel they need another meeting, okay, keep your butt in your seat, attend the next meeting. So these are called marathon meetings. They have them for AA, OA, all of the 12-step models. And they have them particularly 24 hours around all of the holidays. So just it's a quick Google search, or maybe if you use the No app, which you can have your clients download, there's a meeting everywhere. And especially if you're in metropolitan areas like New York, for example, there's a meeting across the street, there's a meeting down the block, there's so many. So just encourage your patients to attend these. For allies of those recovering from a substance, so let's say you don't have a concern, but your cousin, is in early recovery of alcohol. Well, clearly don't hand him a drink. So reconsider using a loved one's substance of choice, or at least ask if it's okay to use the substance around them if it's in the home or all together. So again, using that example, you may be a normie, but your cousin may be in recovery from alcohol. So ask them if you're still gonna, for example, have a beer or something, ask them permission, because that shows that you respect their recovery and that you just care. um, what we tell our clients when they're in recovery, it's about, for the person in recovery, they need to find a healthy support group, people who care about using their substance around them and people who care about their sobriety. So simply asking permission, or if I have this drink around you, is it going to trigger you? That's very beneficial, and that helps really foster the supportive relationships that keep one sober. And as always, don't offer a loved one in recovery their problematic substance or their habit. Just don't, because as an ally, as a supportive person helping someone recover, your word is much more valuable than a stranger's. And again, if you are the person to offer them their substance of choice, they're more likely to take it. So know the power you have in being a supportive ally to someone in recovery. So if someone has alcohol dependency, for example, or abuse as part of their history, and they feel like the tensions at the table and with everyone drinking will be a trigger for you, it's okay to decline. I know a lot of communities and cultures, again, encourage indulgence and say, like, you have to participate. The whole family takes a shot, on at midnight or something like that. It's okay to decline. And it's good to talk about with your patients on scripts maybe they can develop in order to politely decline without being, ostracized from the family. And for anyone in recovery, know that only you know where you're at in your recovery journey. So do what's safest for your recovery. This is a time, I always say in early recovery, this is an appropriate time to be selfish. A selfish person in recovery is someone who's going to recover, or meaning prioritizing it. So prioritizing recovery is the only way to sustain it. And that's a quote from the director of the research team I belong to, Dr. Emily Diamond, and also just a personal mentor of mine. So those with sustained recoveries have been there, and you might find it useful to talk to them if you feel like you need permission. So for people in recovery, it's good to talk to an elder or someone else in recovery who's gone through it all, and to benefit each other. So for those in recovery, it could be their sponsor, it could be someone who they respect who's also in recovery and successfully in recovery. It's always good to have that network developed, especially reinforced during the holidays. All right, so substance use also can intersect with violence around the holidays. Domestic violence markedly increases, and calls to law enforcement increase. They increase around full moons, and they definitely increase during the holidays. Also, unfortunately, suicide attempts increase. Not necessarily completion, but attempts increase during the holidays. So it's good to note that violence towards oneself is also just as important. As mandated reporters, we're supposed to report the possible death of someone else or the client themselves. And yes, As mentioned, relapse increases during the winter holidays, and intoxication can enable all of the things mentioned here. Domestic violence often happens while someone is intoxicated, and also suicide attempts often happen while someone is intoxicated. But that's not saying that people can not do these horrible things sober too. So be mindful of that. And also, as mentioned before, custody battles can flare up while transferring children between parents during the winter holidays. And it's not so fun, but one good way to mitigate that is to exchange custody, obviously in public, or if you need to, definitely at a police station. I've seen it. I've been the clinician alongside while this is happening. It's never fun, but these are the darker moments of our profession that are necessary because not everyone is willing to attend a workshop on developing these skills. And so often we need to just take it to law enforcement. That's their job. That's what our tax dollars pay for. So they can be the mediator while that exchange is happening. Um, Let me know if anyone else has been through that as well. It's kind of more of a social work intervention, but it's, yeah, watching custody exchange happen at a police station, never fun. So, and of course, resources will be provided for these matters on the ending slides of this talk. So just checking in, do I have any questions? Okay, is there, and I'm trying to find in the comments as well. Okay. Okay, so merry consumerism. With the increase in prices, the economic pain of the holidays is a significant stressor. There might be travel costs, costs for presents, clothes, lodging, costs for taking taking time off of work, and etc. So price increases from holiday demand on top of inflation are further compounded by the mass consumption encouraged in US culture. And this promotes the following: problematic spending and accruing debt, which divorced parents, trying to buy the love of their kids over the other. Sometimes there's just competition. And also marketing ads also kind of incite that feeling of competition. Like you can only demonstrate your love to your loved ones by buying them expensive things or the latest model of things. Not really true. Those with tight budgets may feel uncomfortable and even deprived or like they're not good enough. And many people, this is not just US culture, but many people associate their intrinsic self worth with what they can buy others or what others buy them. It's good to set and follow a budget ahead of time. And I really emphasize the follow a budget. Everyone can place a budget or explore a budget. Not everyone can follow the budget. So if that's a concern for our clients, definitely structuring in the treatment plan ways to really follow, what the goals are. And even sometimes putting it as a treatment goal is really helpful. In therapy, it's really beneficial to help our clients decouple their value from their income and the things one can purchase. And as mentioned before, those dealing with problematic spending habits or just dealing with the anxiety of consumerism and just the global economic recession we're all going through and experiencing, attending debtors anonymous meetings can be very beneficial and can help spending, especially if problematic spending lingers after the holidays. So, the gift of stress. Black Friday, for example, which is going to happen this week, gets its name from businesses' profit margins shifting from being in the red into being in the black after Thanksgiving. So, what this means was most businesses, typically around the winter holidays, were not doing so well or not making profits. So, after Thanksgiving, when they anticipate the winter holidays coming and all this gift giving, most businesses started seeing a market increase in their revenue, such that they got back into the black out of the red. So this was capitalized in our society, and now we have Black Friday as its own holiday almost. And now, with the advent of online shopping, we have Cyber Monday. So US culture and society has definitely learned that people really spend outside of their means during this time of year, so they've capitalized on it. So they'll promote a sale on items that were regularly priced only months before. So you'll see characteristically, if you follow your brand, notice in September and October how the price increases on certain items, and notice how it it goes on sale, which really just drops down to its original price after Black Friday. So note the industrial and organizational psychology of that, or marketing, as they call it. So, reminder, we're in a global recession right now that conflicts with consumerism. So, trade and commerce, despite people being told to go spend their money, people don't have this money. So, again, that can increase anxiety and just negative self worth with all of this. Thus, some alternatives or some ways to help mitigate the stress that can come from this global recession. During the holidays, potlucks, they can be a beautiful, budget friendly, and flexible alternative, especially those with dietary needs or those who don't want to spend a bunch of money. So, or especially if the hosts feel like they have to spend a bunch of money to have a beautiful spread or a lot of food. Again, potlucks. This gives everyone a chance to bring a dish they like. This helps those in maybe food or substance recovery to bring alternatives that are helpful for them, and it's more budget friendly for everyone. But it's not for everyone, but it's an option. I've also seen an increase during the winter months of people instating no gifts allowed policies, which helps a family focus on the real reason why their family is gathering, whether it's for religious purposes or just anything else. Again, removing the gift exchange altogether can help people focus on why they really gathered. I've also seen setting a cap on gift costs be really beneficial. And again, anyone can set a cap or a limit to how much they plan to spend on loved ones, but it's actually following through with it that can really help. I had one client who they allocated one budget, and they, for every person, got X amount of dollars, and they actually made a list with everyone's names on it, and they passed it around at on Thanksgiving. They said, okay, for them, that person celebrated Christmas. So they said, okay, for Christmas, everyone gets one gift. You get to write down what you want, and that's it. So that no one was surprised with the gift they received. And that's, in my opinion, that's a good form of effective communication. You're communicating, I'm setting a budget, I'm setting a boundary. I'm also taking you into consideration. So I'm letting you choose what you want me to get you, understanding that it's only going to be valued at this amount of dollars, or this is the most I can spend on it because of my budget. I've also seen people really enjoy Secret Santa, which, if you worship Santa, that doesn't really have to apply. So, Secret Santas, white elephant gift exchanges, or making gifts, making a policy that we exchange gifts, but it's only gifts that we have previously owned, or it's only gifts that we've made by hand. I've seen that also really facilitate, positive conversation and good family dynamics too for people. And also just starting young, teaching the younger generations to again decouple their self-value with the objects people can buy them can be really beneficial, because down the road people learn that, okay, if dad didn't buy me an iPad, it means he still loves me. It just means maybe he didn't have the money for that. But I also know ego comes into play, and sometimes we want to look like the ultimate almighty provider for our kids. So that's also something to be explored, maybe in family therapy or in the adults individual therapy as well. Or again, telling our adolescent and child clients that it's not really about what your parents can buy you, and maybe explaining to them how budgeting even works for the grown-ups. But that can be risky, so implore with caution. Okay, so let's get into the skills and techniques. So first off, effective communication. Communication is very necessary for all persons that talk with each other. And again, you don't even need words for communications sometimes. So again, I'm drilling this notion of focus on commonalities more than differences in conversation. So one of the easiest techniques that we all learned as clinicians, probably in the beginning of our training, was active listening. So cues such as, mm-hmm, yeah, or sometimes repeating the last few words a person said, like, oh, you got a new car? Oh, you went to the store? These are all ways to demonstrate, sometimes verbally, sometimes non-verbally, that you are listening to what a person says. People love to be heard. So if you're going to have a conversation with someone and you don't really know where that conversation will go, first off, letting the person know that you're listening to them helps. Because often when people don't feel heard, what do? They repeat themselves way too much, or they increase their volume, which basically can turn into yelling. So if people simply know that they're being heard, they're more likely to not get aggressive in conversation. As I've been hinting at this whole time, understand develop, and communicate boundaries. So this can be in the form of modeling and explaining how you will and will not accept being treated. So it could be as simple as telling someone your new pronouns. It can just be saying, "Oh, you know what? Yeah, my name is Robert." Or let's say a person's legal name is Robert. Be like, "You know what? Everyone calls me Robbie, but you know what? I'm feeling more grown up. I like to be called the full Robert." Setting a boundary can be as benign as that. Getting comfortable with asserting these boundaries in phrases such as, "That's not in my budget," or "That's not in my violence diet," or "That gives me migraines," or "I don't want to do that," are some of the building blocks in setting boundaries. You're telling people what you're willing to accept and what you're not willing to accept. And this can be done delicately and politely. Just nodding to the comment I made about "it's not in my violence diet," that comes from a previous talk on how to cope with mass violence. Our culture, US culture, is steeped in violence, whether we like it or not. I mean, you turn on the TV, you could probably count in 30 minutes how many people you've seen shot, or how much scenes of violence you've seen. So it's good for us to consciously, cognitively tell ourselves, okay, how much violence am I willing to consume today? And if I'm choosing to watch a horror movie today, does that take up all of the violence I'm willing to see in a day? It's also beneficial to acknowledge what we consume before we go to bed. Like, am I going to watch a serial killer documentary before I try to go to sleep? So, just telling people, you know what, that sounds too violent, it's too aggressive. I know I don't want to talk about the recent mass shooting that happened. These are all part of one's violence diet. And again, these are all part of putting a boundary with yourself and putting boundaries with others. Also, in communicating with others, some of the basics: use inclusive language. So, this can mean challenging ethnocentrism or challenging xenophobia. So, ethnocentrism, thinking that how my community and my culture does things is obviously how the rest of the world should do it, challenging that. So, one way is like the example I gave a few slides ago, which just acknowledging, okay, I may be of a certain religion, but I can also acknowledge that I was probably influenced by this religion by the place I was born. That helps us to acknowledge that not everyone was born in that region. Maybe not everyone will hold that religious belief, and being okay with that. Or xenophobia, which is horrible. Just being fearful of just stuff that's different or how things change. One way to help desensitize us to this aversion to change and our aversion to things we're not familiar with is just simply by acknowledging there's going to be people who don't look like me. There's going to be people who don't speak the same languages as me. There's going to be people who have different values or maybe contradictory values than me. And that's okay. No one has proof of their belief system quite yet. And more on effective communication. We've all heard about I statements, but it benefits us just to repeat this. It's beneficial more so to speak from I and to limit our use of you. Whenever people hear you, who, or whatever language they speak, whenever someone feels that an experience is being projected onto them, we instantly get defensive. That's just our humanity. So if someone keeps saying, "You did this," you, we instantly get defensive. So if we, instead of saying, for example, you know what, um, "You cut me off on the freeway and I think you need to learn how to drive." It could be more beneficial by saying, "You know what, I was cut off. I get dysregulated or I get nervous every time someone cuts me off," rather than saying you directly did it. Um, uh, Piggybacking on that, we can prevent blaming or attacking others by applying the XYZ method of communication. So when X happens, I feel Y because of Z. So when I'm driving, I feel nervous when people cut me off because I feel a lack of sense of safety, rather than saying, "You jerk, you cut me off and you made me feel unsafe." So again, speaking for my, limiting you, and applying the XYZ method. In conversation, it's also beneficial to use the ORs, which is something most of us learn in our training as well. So when we're having conversation and we're sometimes in the small talk phase before it gets into deeper conversation, it's easy to maybe commit to memory that some of the easiest things to ask are life updates, um, places people have traveled, or upcoming goals, things like that. So in conversation, asking for life updates, for example, and genuinely listen when engaging with loved ones and apply the ORs. So again, if we've started off with these nonverbal cues or this active listening, people then start to believe that we are actually engaged with them. And then if we speak from I and limit you and maybe apply X, Y, Z if conflict arises, this all sets the stage for a more pleasant time and effective communication. So, of the ORs, I'll explain those in a moment. The O stands for open ended questions. So, for example, about work, school, friends, upcoming projects, sports, places you visited or eaten at, for example. If we start with open ended questions, that breeds much more conversation than yes or no questions. There's a difference between did you eat yesterday versus where did you eat yesterday for that. And plus, trust me, people love to talk about themselves. So if you ask people open ended questions and actually listen, that helps facilitate a beautiful exchange in that moment. The A in ORS is making affirming reflections and being kind whenever possible. So when someone says, if someone was communicating to me, oh, yeah, you were cut off on the 405, affirming that, wow, that must have been upsetting, or that must have been nerve wracking. Huh. Just that little affirmation, again, helps people understand that you're listening to them, that they're being heard, and that you're actually digesting and processing what they're saying. That facilitates social facilitation. The R in the ORs, again, is the reflections. So reflecting back and trying to genuinely recall what some of the things that people say in conversation are. So a reflection would be, yeah, so when you were driving on the 4th and that guy cut you off, it sounded like that was really anxiety provoking. That's a reflection that, again, helps the person know that you were listening. And true to, which I don't have written here, but there's a DBT skill by Alan Downs called One Person, One Conversation, One Thought at a Time. I may have misquoted that. But we become better communicators when we suspend our own thought and while we actively listen and remind ourselves, dedicate my time and attention to this person, maybe make eye contact if I'm comfortable with that, and suspend all my other thoughts. Because I've often seen challenges to communication be like the example of two people in conversation, but really they're just waiting for the other to stop talking. So sometimes a person is just sitting back, letting a person talk, not digesting, not processing what they're saying, just so they can insert their own word. It's like two people playing double dutch, like waiting to jump in with that. So providing open-ended questions, affirmations, and reflections actually get us to suspend our own thought processes to hold space for somebody else. And then, of course, if a person has executed active listening, using I statements, XYZ if there's conflict, and open ended questions, affirmations, and reflections, then we're much better and much in a more solid place to provide a summary of what the other person said. So it could be as easy as every few minutes just saying, yeah, okay, when you were cut off, you felt anxious. Or when someone is updating you on their new job, it's like, wow, okay, so you were given this new job. It sounds like you really like the benefits and the pay. Wow, just summarizing what someone said really goes really far. And I'm sure most of us can think of examples in the consultation room where that's been really beneficial. We maybe not have had the answer for a client's issues, or we may have not had the best intervention or interpretation ready for them. But the fact that we sat there, we listened, and we summarized what they had just told us helps the client feel more heard and held in that space. And that can definitely translate to time with loved ones. And again, if anyone else has additional reflections, or if anyone has maybe times where some of these interventions have backfired in clinical settings, please let me know because this helps me learn. And some more communication techniques. So, if one is bringing a guest to a family event, it's beneficial to have a system in place of helping the other exit messy situations. So let's say you bring your partner to an event, you see your partner talking with, I don't know, your uncle that you know always likes to talk about politics, maybe having a code word or a code gesture, like, I don't know, tug on your ear or pat your head when you want me to come grab you and like save you from conversation with my uncle. Having little things like that both helps strengthen the dynamic those two people have and also helps them avoid messy situations. Also, another important thing, especially between romantic partners, is to discuss with partners the family norms in regards to public displays of affection and just to discuss PDA around family overall. For some cultures, it's very welcomed for a new boyfriend to kiss, the new girlfriend in front of the family. For some cultures, that's not what we do. And for some family values, some families value intimacy and love. Some don't as much. So it's good to talk with family on what we can expect, how we can expect to behave around family, just so people aren't surprised when things happen. So let's say you kiss your partner on the cheek and that really offends, a relative. We would hate for that to happen. So again, it also helps really facilitate open-ended communication before these events even happen. And moving on, if one doesn't want to participate in an activity that they're asked to participate in, again, reminding people that it's okay to politely decline activities you don't want to participate in, especially if they're tied to maybe a belief system you no longer value or participate in, or if it involves ingesting a substance you're trying to abstain from, or anything. It's helpful to remind our clients that they don't have to do anything they don't want to, despite maybe the culture telling them they should be doing it. And then also, just true to food and drink itself, also know that it's okay to politely decline any food or drink they don't wish to consume. This may butt heads with maybe the host event. You don't want to offend people and don't want to communicate like, oh, I don't want your cooking. But so maybe working with our clients on scripts on how to politely decline in a culturally responsive way, if that is of concern to your clients. And then it just always benefits us to remember that our client is always the expert in their experience. Our clients are the experts in their culture because they've typically been raised in it. So if you maybe don't belong to the same community or culture as your clients, it's okay to let them inform you. And sometimes clinicians, I've heard, especially with like supervisees, they're kind of nervous to place the burden back on the client, to ask the client to educate them on something. But if we don't ask these necessary questions, how are we going to learn about a culture we weren't raised in? So it's always good to remind trainees and ourselves that it's okay to be educated by the client so long as we respectfully ask for it. Moving on, um, teaching and training and coaching our clients to self-advocate and request alternatives to food or drink that they don't partake in is also helpful. Because there's going to be a time, hopefully, where our patients have transitioned out of therapy, they've developed good coping skills, they've processed traumas, they've learned how to better navigate situations. So it's good to let them know, at some point, we're not going to be working together. And that's when you're going to be encouraged to self advocate, speak up for yourself, stand up for yourself. So a good, easier way to get used to this is to start with food or to start with any of the events that we mentioned beforehand. So again, this is where I say implore with caution. Consider if it's worth for a client to have a concise explanation why they don't want to partake in something that they're asked to. I'm not saying it has to be a lie or it doesn't have to be an embellishment of the truth, but consider if it's worth having a concise explanation of why they don't do something. Sometimes people want just a quick response of like, no, I'm on antibiotics. I don't want to drink that. Other times, sometimes our clients welcome a conversation because maybe that's a teaching moment for them with their loved ones. So just again, your client knows their experience better than you do. So listen to them and let them teach you on how to coach them. And again, I'm just going to repeat this. For those in substance recovery in particular, bring your own alternatives if it's not offensive to the host. Or again, maybe you can as the clinician, you can facilitate a conversation between that individual and the host such that they can ask this and make this request without it offending someone. Because think about it, I've had so many clients say like, well, I'm working on my sugar intake, I'm decreasing my sugar, but my grandma is going to expect me to eat half of the pie she makes every year. So how can we find a delicate way of having both people get their needs met? How can grandma feel validation and love by baking with love something for her grandkid, but how can the grandkid also adhere to their diet and being careful and mindful to their own body without hurting grandma? So ineffective communication, it's really beneficial for all persons, including clinicians and our patients, to be able to spot moments of ineffective communication such that it prompts them to use these adaptive skills we've been coaching them on. So it can help prepare us by learning to spot and identify maladaptive communication styles such as microaggressions. So, you know, I'm speaking to a room. I also myself identify as a person of color. So we've all heard microaggressions, maybe in the form of, where are you from? And then I say, oh, West LA. They're like, no, where are you from? That's an example of a microaggression, suggesting you're different and I'm pointing it out in this benevolent question. So spotting microaggressions and training our clients to spot microaggressions is beneficial. Moving the goalpost. So I hear this often when clients report that they're never good enough or they're never enough for a person or a situation. So let's say a person accomplishes something that another person set before them, but the other party moves the goalpost. So they're like, no, actually, after you complete 3 more exercises, you're going to be good enough. Or after you accomplish, 3 more victories on your soccer team, that's when I'll value you. Often you see this when people receive conditional love. So moving the goalpost is something beneficial for our clients to start to identify and spot. Gaslighting, being told what someone's experience is rather than letting the other person inform you of what their experience is. Negging, or sometimes called backhanded compliments, where it sounds like what the person is saying is positive or benevolent, but actually it's a critique packaged in a compliment. Virtue signaling. You often see this when people are new to developing their skills as an ally and supporting a community that doesn't necessarily impact them. Sometimes you hear people almost try to dog whistle, like, oh, you know what, my best friend who's gay, or my coworker who's African American. You see how people want to insert, like, just so you know, I'm cool, or just so you know, I'm an ally. True allyship doesn't have to be told, it's communicated through our actions. Also, it's also beneficial to train our clients to spot fallacies. So you hear this a lot with like debate conversations and arguments. So just brushing up on the fallacies, on fallacious ways that people can manipulate a conversation, kind of like the either or, the slippery slope. These are all helpful things to train people to know. And then outright verbal aggression. If someone raises their voice extra high, or if someone calls you a name or overtly attacks you, this is not okay. And these are all things to look out for when we're around mixed company. And all having an awareness of all these maladaptive forms of communication helps prompt us after a good rehearsal and training to use these adaptive techniques. So conflict resolution itself. Again, acknowledge that anticipating, accepting compromise for a pleasant time is probably best. We're all human, and humanity tends to prefer the path of least resistance. So it's about communicating to our clients that they're not submitting to someone else's opinions. They're not having to check their ego or their pride. They're just having to compromise so that everyone has a pleasant time when we all visit. So when feeling tension, it's helpful to clarify if the matter is a simple communication as well. Miscommunications are just incredibly common, especially because a lot of our communication these days is through text or email. And one person's writing style and communication style may just be misinterpreted by someone else. So it's just easy to first off just say, oh, was I misunderstood, or did I misunderstand you? That's one of the quickest ways to dissolve any conflict that may happen. That doesn't always work, and that's why we have other skills too. So, one beneficial way to kind of resolve a potential argument or such is to agree before disagreeing. So, one of the easiest techniques, and I learned this from what was the book called? Spy the Lie, I believe, by Houston et al., which is cited, below. These are from FBI agents trained at Quantico. I believe they're also professors at Quantico. One of the easiest ways to diffuse a potential argument is to just say right and. So, for example, if someone is debating, what LeBron James is the best person on the Lakers versus Kobe Bryant was the best person to ever play for the Lakers, you can agree before disagreeing. You can say, you're right, Kobe Bryant was an excellent basketball player, and I think LeBron was skilled X, Y, and Z. Or, for example, you can say, I definitely see your point, and disagree however you see fit. You'd be so surprised how just agreeing before disagreeing, even if your opinion is the direct opposite of what the other person is arguing, you'd be surprised how just packaging it in that form can actually decrease the potential for conflict. Also, question or empathically challenge any off-putting questions or poor humor. So if someone does a offhanded or bad joke, or if someone offends someone, there are ways to diffuse this. Simply asking a person to repeat and really rethink an off-putting question or an off-putting comment is the first step. So when we have someone repeat a negative comment, it forces them to cognitively reprocess it and regenerate that spontaneous language. So if you get someone to repeat a bad joke or an offensive comment, it kind of loses its value, and the offender tends to become uncomfortable because they've just rethought what they said. And another person asserting a boundary by saying, "Can you repeat that?" or "What was it you just said?" That also communicates to the person that what they just said was not okay. I've also learned that the "why do you ask" retort is a good way at diffusing challenges or aggression. So if someone is saying, "Okay, Billy, you've come single to the past three, Hanukkah evenings. You've come to them single, unpartnered. When are you going to find a partner?" Simply asking, "Why do you ask?" or "Why is my relationship status such a concern to you?" Asking it in that way, again, gets the person to reassess their question, and it genuinely asks them, why do I value this so much? Why do I want to put this person on the spot? Why do I want to enable this person to feel uncomfortable? Also, another technique in conversation when there's conflict, or when a person suspects that the other party is attempting to make them feel uncomfortable or be aggressive, is the 4-second pause. Our brain interprets silence as a rejection. So if you hear something off putting or something that offends you, just sitting there, waiting, breathing, 1, 2, 3, 4, the other party will likely fill that space because silence is, again, interpreted as rejection, and it's just uncomfortable for people. And us as psychotherapists, I think we all know and can appreciate the power of silence, or the power of a pregnant pause. So, more conflict resolution. So, with diffusing poor humor in particular, one way to redirect or diffuse it is to simply have the entire joke repeated. So, when a person drops the offensive punchline, just say, "Can you repeat that? I didn't get it." Again, it has the person cognitively reprocess and reevaluate what they were just saying. Sometimes playing naive to the punchline also helps diffuse it, because if someone says an offensive punchline, the other party doesn't react, it's also interpreted as rejection, or that it's not okay to the other party. And then also, the quickest way to diffuse any joke, even a funny one or even a positive one, is to have the punchline be explained. So if someone says a bad joke, or someone says something in jest and it's offensive, having them explain why that's meant to be funny also diffuses it. And when in doubt, just repeat these 3 techniques, and you'll find that the other party will probably stop talking about this, or will probably talk about something else. Again, setting and upholding boundaries. Ask what is to be accomplished by arguing on a matter. So if someone really wants to argue why they think Proposition X or Proposition Y or Proposition Z should have passed or should not have been passed, ask them what is to be accomplished right now. So it can be as sassy as you want. It can be like, "Okay, the election happened a few days ago. What is this argument going to accomplish? Why is this going to help? Or why is changing the tone of this gathering beneficial in this moment? Or why do you need to disrupt the conversation in this?" These are a little more delicate, and these involved a little more gall to bring this up, but these are also techniques. Also, something I've heard: when a person is offended, triggered, or a bad joke is said, simply asking, "Why do you feel it's okay to say that?" or "Why do you feel it's okay to ask this?" is very effective in that. Again, it stops a person, it has them rethink what they just said. Sometimes it has them re explain why they think it's funny, and it helps them realize that what they just said was not okay. And by holding and asserting this boundary, it communicates and trains people how to treat you and how not to treat you. Again, we have to teach people how to treat us. And then ultimately, it benefits all of us to adopt the empathic challenge and the DBT skill, that to understand that whoever's offended you is doing the best they can. Sometimes people don't do the best job. So again, whoever has wronged you is using the only tools and skills they have in that moment. And that helps us develop a little bit of compassion for people when they're hurting us or offending us. Also, another good, I believe, is this actor DBT? I forget. It's a DBT skill. Make a case for the offense. So, jumping back to the 405 example where someone gets cut off, the next time you're cut off and maybe your road rage flares up, try to build a case on why they did that. So, okay, maybe that person is late to work, and if they're late one more time, they'll get fired. Maybe that person's partner is in labor right now, or maybe that person genuinely didn't see me. So, trying to find compassionate explanations for the other party. It's probably never going to be confirmed. You might never see that person on the 405 again in that example, but trying to build a case on why they offended you can also be beneficial. Okay, next, the following is a checklist. So again, if anyone wants a copy of these slides, they're available on my website at no cost, and they're also in the chat box here. This is a digest of the questions I've found to be most beneficial to ask our clients and ask ourselves when about to be in a mixed company at any real time of the year. So, what do the holidays mean to me and why? Where am I going? Who is hosting and who will be there? Do I want to participate or go? Is the invitation mandatory? How can I politely decline if I don't want to go? How does my family handle microaggressions and gossip? Oh, my mistake. How does my family actually handle microaggressions and gossip? How was conflict resolved when growing up? And how may that pattern play out now? Who was expected to provide the boundaries and discipline, and how did it go? How are the family values upheld and put into practice? How would you define unconditional and conditional love? What is one's understanding between tolerance and acceptance? Who might challenge your peace, and i.e., who should be interacted with the least? What kind of allyship and support will you benefit from the most? Or alternatively, what kind of allyship and support can I provide others? And who can provide this during this time? Where is my health, and how risk am I willing to assume? So, with the notion that more than over 40% of people bent the truth when it came to their COVID statuses, for example. So, if you're immunocompromised or really don't want to get COVID, think through your COVID priorities before you accept an invitation. And what I'm trying to communicate here through the research is that people don't always tell the truth. So, it's always good to know our own boundaries, and it's always good to really protect ourselves ultimately, because some people may say they're not going to do something. Some people may say they're healthier than what they were, but that's not always the case, unfortunately. More things. What is your understanding between debates, arguments, and fights? Where can I prioritize mental health and physical well being? Ultimately, could I, and any guess, be myself around these people, or can I be authentic? Will I, will I, or do what we have to put on a persona? Okay. Will I have to put on a persona or temporarily be inauthentic to get by? Can I or we afford this? Are the pandemic, flu, or other congenital illnesses too much of a risk during this time? May I participate virtually, alternatively? And would this be a better option for holidays? So, again, these are all what I just read were process questions that really benefit ourselves and our patients to ask these and to maybe guide a session or two before the winter holidays. So, taking care of ourselves. Discuss the matters explored here in therapy before and after the holidays. Set up contact and support in the absence of a therapist or doctor one is already working with. For example, one skill could be meditate in your car 3 to 5 minutes before you arrive at an event, or excuse yourself for a grounding technique if need be. And we can definitely teach our clients, quick 30-second, 90-second grounding exercises to help them in times of dysregulation. So also visualize any dreaded buzz topics along with the setting they may take place. Then practice visualizing removing yourself, then repeat. So visualizing negative situations and visualizing removing yourself can actually really help in training ourselves to exit sticky situations. And if the time comes, physically remove yourself from a challenging scenario just as you visualized and prepared. Or put together go-to or canned responses to shut down topics you don't want to talk about, and you don't have to. Also, realistically prepare your guests on what to expect in a sit-down conversation using the things to ask yourself before seeing family prompts I had just explored moments ago. Set a budget for holiday spending and stick to it. Got to repeat that. Then also a contingency plan. So overall, know your risks and limits if things don't go so well. So for our clients and for ourselves, if we need to, consider lodging in a separate place that you can go to or find refuge if needed. Have a plan with any guests on what you'll do if the need to leave arises. Know when it's time to remove yourself, trust your gut, and remove yourself. Our intuition is very powerful. We go throughout our lives watching normal behavior. So when if something feels abnormal or just odd, trust your gut, because that's your intuition telling you something isn't right. Stay in contact with a sponsor if in recovery and contact them as needed. Be available for or receptive to help from chosen family. So, for example, host a Thanksgiving or attend one. Go to support or invite someone to join a 12-step meeting. So you can either attend as support or you can invite someone to support you in your recovery. Set a time limit and share your location with others along with any time they should hear back from you. Reconsider going to an event if you fear or anticipate any threat to your safety or well-being. If not spending time with family overall, consider connecting with a trusted loved one. Because ultimately, sometimes people don't want to attend an event for the holidays, whether they're grieving or any other reason, and that's okay. So last, supporting others. This is being an ally. Some individuals actually feel even keeled and look forward to seeing loved ones during the holidays, but others not so much. And we can choose to support folks as an ally by understanding that allyship is intersectional, accepting that allyship is developmental. It can take many forms, and we can support many types of people with minority statuses, whether they're in recovery, ethnic minority, religious minority, etc. Like, for example, for every 100 Americans, for example, about 7 identify as LGBTQ+. So a few tips there. Get comfortable using the pronouns of the genders your queer loved ones date or their own pronouns. Decrease the use of words like friend, little friend, when acknowledging and knowingly referring to a potential partner of a queer loved one. And just also understand that allyship is a journey. So there's multiple ways that one can be an ally. As an ally, that's supporting a minority group when it's convenient. An accomplice is when an ally shoulders on some of the minority group's risk in their advocacy. And a co-conspirator is when an accomplice becomes proactive in their advocacy. And this all comes from Brittany Packnett, who did a wonderful 3-tiered framework on allyship, and citation down here for Women's Voices 2019. So for us as clinicians, preventing compassion fatigue is very important. So clinicians should set healthy boundaries for themselves regarding their availability and how clients may get a hold of them during the holidays. And also psychotherapists can take time to reflect on the ways they've helped people throughout the year. That helps us to prevent burnout by realizing how much good work we've done and the good work we're probably going to give in the next year. Therapists can also reflect on professional goals achieved or goals in progress or goals to set or intentions to set for the coming work year. And ultimately, it's beneficial to remember to connect with folks where you can really be yourself. So no food is needed. And if one connects with people they care about and who they care about them, that's a successful holiday, at least in my book. A few more tips on preventing compassion fatigue. It's really beneficial to check in with our clients on A, having enough medications during the winter holidays, B, developing contingency plans and relapse prevention if things don't go so well, C, being connected to resources for specific concerns, D, having safe, welcoming places to go to for the holidays, and E, having solid, conscious reasons for choosing to be alone. And again, this helps us as clinicians and it helps the people we work with. And I'll end with some local resources that are especially beneficial during the holidays. These are Los Angeles-based resources, all available on this slide deck. National resources. And then my closing thoughts are, emotions can run high when loved ones get together. Arguments can happen and more. This workshop helped attendees develop effective communication skills and conflict resolution techniques to effectively navigate conversations and better cope with triggering situations prompted by assumed conflict with loved ones during the holidays. Attendees explored navigating sensitive topics such as religion, politics, and relationships amidst mixed company. And just here are the following citations. And with that said, I'm happy to open the floor for any questions or comments.